All right, let's dive into the world of knee health,
Sounds good.
especially for those of us, aging gracefully,
Mm-hmm.
but still wanting to hit the trails or the tennis court, whatever it might be.
Absolutely.
We're taking a deep dive today into a fascinating medical text,
Oh,
all about managing knee injuries in, well, shall we say, seasoned athletes.
right.
And the goal here is to arm you with the knowledge
Yeah.
to really understand both the conservative and surgical options out there
Mhm.
so you can keep those knees in tip-top shape.
I love it.
One thing that really jumped out at me
Yeah.
was this idea that even if you end up needing a knee replacement,
Okay.
you might still be able to enjoy things like skiing and mountain biking.
It's true. It's pretty amazing what's possible these days with advancements in both surgical techniques and rehab.
It's encouraging, right?
It is.
I mean, I
Yeah.
think a lot of people assume that a knee replacement is kind of like the end of
The end of the road.
the road for an
Active lifestyle.
for an active lifestyle.
Right.
So that was really eye-opening.
Yeah.
But let's rewind a bit, shall we?
Sure.
And talk about something that can affect people of all ages. ACL injuries. This chapter dives into the whole debate around whether surgery or conservative treatment is the best route.
It's a big one.
It is, especially for, well, older patients.
Absolutely. And it's a question that comes up a lot in my practice.
What are the key factors, would you say, that go into making that decision?
It's really not one size fits all,
Right.
I mean, age itself isn't the deciding factor, which is what a lot of people might assume.
Okay.
This chapter actually highlighted a study that looked at patients over 60,
Wow, over 60.
and many of them were able to return to their sports without surgery,
Really?
and they didn't show any signs of arthritis progression years later.
So it sounds like it really boils down to the individual,
Exactly.
their activity level, the severity of their symptoms, and what their goals are.
That's it in a nutshell.
So let's say someone is facing this decision. What are the questions they should be asking their doctor,
Good question.
to make sure they're making the right choice for their situation?
Well, I always tell my patients, the first thing is to be realistic about your goals, right?
Right.
What activities are most important to you?
Okay.
And what are the chances of getting back to those activities with and without surgery?
Mm-hmm.
Then we really have to dive into the potential risks and benefits of each approach.
Okay.
So with surgery, what are the potential complications? How long is the recovery process?
Okay.
On the flip side, if you choose to go the conservative route,
Yeah.
what kind of physical therapy will you need?
Mm-hmm.
How effective is it likely to be?
Right. It's a lot to consider, isn't it?
It is.
But I guess those are the important conversations to have.
Absolutely.
So you can feel confident in your decision.
Right.
All right. So let's move on to something I think a lot of us, as we get older, kind of worry about.
Yeah.
Osteoarthritis. I was struck by that statistic from the chapter.
Yeah.
1 in 7 adults will deal with osteoarthritis in their lifetime.
That's a lot of people.
It's huge.
Yeah.
So is this just like an inevitable part of aging?
Well, it's true that as we get older, our risk goes up.
Right.
Wear and tear on the joints, it's a natural process.
Right.
But here's the thing. An osteoarthritis diagnosis doesn't mean you have to give up on staying active.
Okay, so there's hope.
There is.
That's good to hear.
It's all about managing the condition
Mm-hmm.
and finding ways to stay active within, your limits.
So let's talk about those management strategies.
Okay.
What are some things people can do to keep moving even with osteoarthritis?
Well, first and foremost, maintaining a healthy weight is crucial.
Okay, weight matters.
It does.
Why is that so important?
Because every extra pound puts more stress on those joints.
Ah, I see.
So even a small amount of weight loss can make a world of difference.
That makes sense.
Yeah.
And of course, exercise is always recommended, right?
Yeah.
For joint health.
It is.
What kind of exercise is best for someone with osteoarthritis?
The key is targeted exercises
Okay.
that strengthen the muscles around the knee.
To support the joint.
Exactly. That helps stabilize the joint and reduce pain.
Okay, so what are we talking about here?
Think squats, lunges, leg presses, that kind of thing.
Sorry, strength training.
But it's super important to start slowly and gradually increase the intensity,
Yeah.
No need to overdo it right out of the gate.
What about low-impact activities?
Oh, those are fantastic.
Like
Swimming, cycling, walking.
Yeah, those are still okay.
Absolutely. They're much easier on the joints.
Okay.
And don't forget about flexibility.
Oh, right, stretching.
Yeah, stretching and the range of motion exercises, those are super important for maintaining that joint mobility.
So we've got strength training, low-impact cardio, and flexibility.
That's the trifecta.
Now, I've seen a lot of people wearing knee braces. Is that something worth considering?
Braces can be a game changer, especially for folks with mild to moderate osteoarthritis.
Okay.
They offer support and stability, which can really help reduce pain and improve function.
So how do you know what kind of brace to get?
Good question.
There's so many out there.
There are a ton. I always recommend talking to your doctor or a physical therapist.
Okay.
They can assess your needs and recommend the right type of brace for your specific activities.
What about those supplements you hear about all the time?
Oh, you mean like glucosamine and chondroitin?
Yeah, those are the ones. Do they actually work?
You know, that's a question that comes up all the time.
Yeah, I bet.
Some people swear by them.
Yeah.
But the research is kind of mixed. It's not a slam dunk.
So should I be taking them or not?
Honestly, the best thing to do is talk to your doctor.
Okay.
They can help you weigh the potential benefits and risks and make sure those supplements won't interact with any medications you're taking.
Now, what about over-the-counter pain relievers? Things like ibuprofen?
Yeah, a lot of people rely on those to manage their knee pain.
Yeah, I mean, they're easy to get.
They are.
They're relatively inexpensive. So do they have a place in managing osteoarthritis?
They can, for sure.
Okay.
NSAIDs, you know, the non-steroidal anti-inflammatory drugs.
Right, like ibuprofen, naproxen.
Exactly. They can be helpful for managing both pain and inflammation.
But there are some caveats, right?
There are, especially if you're older.
Okay, so what are the concerns there?
Well, long-term use of NSs can have some side effects. They can be tough on the stomach and kidneys, and they can even increase the risk of heart problems. So again, talk to your doctor.
Okay.
Make sure you're using them safely
Yeah.
and for the shortest time possible.
All right, good advice. Now, this is where things get really interesting.
Oh.
Tell me more.
The chapter mentions some newer treatments.
Okay.
Like hyaluronic acid and platelet-rich plasma injections.
Oh, yeah, those are becoming more and more common. I've heard of them, but I'm not really sure how they work.
So these are often considered when the more conservative treatments, you know, like exercise and medication, aren't really providing enough relief.
Okay.
Hyaluronic acid is naturally found in your joints fluid.
Okay.
And these injections, they basically aim to replenish it.
So you're giving your knee a little lubrication boost.
Exactly. Think of it like oiling a squeaky hinge.
And what about PRP?
PRP, that stands for platelet-rich plasma.
Okay, I knew that.
So it involves taking a sample of your own blood, concentrating the platelets, and then injecting those platelets into the knee joint.
Interesting. And what's the idea behind that?
The idea is that those platelets are packed with growth factors
Okay.
that can promote healing and reduce inflammation.
So what's the verdict?
Well, the research is still ongoing, but there are some promising results.
Okay.
Some studies have shown that these injections can provide pain relief and improve function.
That's good news.
It is, but it's important to remember, you know, individual responses can vary, and they're not a miracle cure.
It seems like there's a lot you can try before resorting to surgery.
Absolutely.
But let's face it, sometimes surgery is unavoidable.
That's true.
So the chapter goes into detail about a few surgical procedures.
Okay.
One that caught my eye was cartilage regeneration.
Oh, yeah, that's a hot topic these days.
Is it true that doctors can actually regrow cartilage?
Well, it's not quite as simple as regrowing cartilage, but there are some techniques that can help.
Okay, so what's going on there?
These techniques are usually considered for younger patients who have what we call focal cartilage defects.
What does that mean?
It means there's a specific area of damage rather than widespread arthritis.
Got it. So how do these procedures actually work? What are they doing in there?
Well, there are a few different approaches.
Okay.
One is to actually drill small holes into the bone underneath the damaged cartilage.
Drill holes?
Yeah, it sounds a little crazy.
Why would you do that?
The idea is to stimulate bleeding and the formation of scar tissue.
So you're basically creating a sort of patch.
Yeah, and while that scar tissue isn't exactly the same as healthy cartilage, it can provide some cushioning.
Interesting. Are there other techniques?
There are. Another option is to transplant healthy cartilage.
Okay.
Either from another part of the body or from a donor.
Oh, wow.
And there were some really cutting-edge techniques using bioengineered materials or even stem cells.
Stem cells? That's amazing.
It is. The goal there is to try to stimulate the growth of new cartilage.
So how successful are these cartilage regeneration procedures?
Well, a lot of factors come into play.
Like what?
Age is a big one. Younger patients tend to have better outcomes.
Okay.
The size and location of the defect also matter. And of course, everyone heals differently.
Right, so it's not a guaranteed fix.
No, but it's a promising option for some patients.
Absolutely. The chapter also mentions a procedure called high tibial osteotomy. Yeah, or HTO. What's that all about?
So HTO is an option for folks with arthritis that's mainly affecting one side of the knee joint.
Okay.
And instead of replacing the whole joint,
Yeah.
the surgeon actually reshapes the tibia bone.
The tibia, that's the shin bone, right?
That's it.
To shift the weight away from the damaged area.
Precisely.
So they're not replacing the joint, they're realigning it.
You got it. It's like realigning the foundation of a house to distribute the weight more evenly.
Ah, that's a good analogy.
And you know what? This can significantly reduce pain.
Really?
And improve function.
So it can potentially delay the need for a knee replacement.
Exactly.
Who would you say is the ideal candidate for this procedure?
Often, it's a good choice for younger, active patients
Okay.
who have good knee stability, but are experiencing pain because of uneven wear and tear on the joint.
The chapter even mentions studies where patients who had this procedure were able to go back to things like downhill skiing and mountain biking.
It's true. It's amazing what's possible.
That's incredible.
It is.
All right, so we've talked about cartilage regeneration and this HTO procedure. Now let's get to the big one. Knee replacements.
Okay, the main event.
For those of us with more advanced arthritis, this is often the path we end up taking.
Yeah, it's a common procedure.
Can you walk us through the different types of knee replacements?
Sure, there are two main types. Partial and full knee replacement. A partial knee replacement, also known as a unicompartmental knee arthroplasty, or UKA.
UKA.
Exactly.
Okay.
It's used when the arthritis is only in one compartment of the knee.
Right.
And it's a less invasive procedure than a full knee replacement.
Okay.
So the recovery time is usually a bit quicker.
Got it. So for someone who's a good candidate for a partial replacement, what are the main advantages?
Well, like I said, the recovery is typically faster.
Okay.
And you're preserving more of your natural knee joint.
Oh, I see.
Which is always a good thing.
Right, less disruption.
Exactly.
And does that also mean you get a greater range of motion?
Often, yes, compared to a full replacement.
Okay, that makes sense. And when would a full knee replacement be recommended?
So a full knee replacement, also called a total knee arthroplasty, or TKA.
Okay, TKA.
That's usually considered when the arthritis has affected multiple compartments of the knee and those conservative treatments we talked about earlier.
Right, the exercise, the medications.
Yeah, all of that.
They're just not cutting it anymore.
Right, they're not providing enough relief.
Okay.
So in a TKA, we're basically replacing the damaged surfaces of the knee joint.
With what?
With artificial components.
Okay.
Usually made of metal and plastic.
I think a lot of people worry about how long a knee replacement will last.
Yeah, that's a common concern.
Like, is it a one-time thing?
Right.
Or will you need to have it done again down the road?
That's a good question.
What's the typical lifespan?
Well, knee replacements are really durable these days.
Okay, that's good.
But they don't last forever.
Right, nothing does.
But the good news is, with all the advancements we've seen in materials and surgical techniques, the lifespan of these implants has increased significantly.
Okay, so how long are we talking?
Many people can expect their knee replacement to last for 15 to 20 years.
Wow, that's pretty good.
Or even longer.
That is reassuring. So if I get a knee replacement, can I still be active?
It's not just about being able to walk without pain.
Right, because I think that's what a lot of people assume.
Yeah, but you can absolutely still enjoy an active lifestyle.
So what can I do? Give me some examples.
Think hiking, swimming, cycling.
No, those sound good.
Even golfing and dancing.
Oh, so I can still hit the dance floor.
You got it.
That's great news.
Of course, you want to work with your surgeon and a physical therapist.
Yeah, to make sure.
Yeah, to create a plan that's right for you.
That aligns with your goals.
Exactly.
I have to go back to something that really stood out to me in the chapter.
Okay, what's that?
This idea that even with a knee replacement, you might still be able to do things like skiing and mountain biking.
I know, it's pretty wild.
Is that really realistic?
It can be.
Are we talking about, like, you know, bunny slopes and gentle trails, or can people actually get back to, like, their pre-injury intensity?
That's the million-dollar question, right?
Yeah.
It really depends on a few things.
Okay.
Well, for starters, your overall health and fitness before surgery.
Makes sense.
So if you were already active and in good shape, you've got a better chance of getting back to those activities.
Okay, so being fit helps.
It definitely does.
What else matters?
The skill of your surgeon.
Oh, of course.
The type of prosthetic they use, all of that plays a role.
But it's not just physical, right?
You're right, it's not.
There's a mental and emotional component too, isn't there?
Absolutely.
What do you mean by that?
Well, getting back to high-impact activities after a knee replacement.
Yeah.
That takes serious commitment to rehab. And you also need a certain tolerance for risk.
Right.
And a good dose of self-awareness.
Because you have to know your limits.
Exactly. You have to be honest with yourself about what you can and can't do.
And be willing to adjust your expectations.
Precisely.
So it's not just about what your body can handle.
Right.
It's also about what you feel comfortable with.
That's a great way to put it.
So if someone is thinking about a knee replacement and they dream of hitting the slopes again, what's your advice?
First and foremost, talk to your surgeon.
Okay.
Be open and honest about your goals, your concerns, what you want your life to look like after surgery.
And make sure you're both on the same page.
Exactly.
What else is important?
Finding a good physical therapist.
Okay.
Someone who specializes in post-surgical rehab for athletes.
That makes sense.
They can help you regain strength, flexibility, and proprioception.
Proprioception, that's a big word.
It is, but it's basically your body's awareness of where it is in space.
Oh, okay.
So think about like walking up a flight of stairs without having to look at each step.
Right, you just do it automatically.
That's proprioception.
I see.
And it's essential for balance and coordination.
Especially for activities like skiing and mountain biking.
You got it.
So good surgeon, dedicated physical therapist. What else?
Be patient.
Okay, patience.
Recovery takes time.
Yeah, it's not a quick fix.
It's a journey, not a race.
That's a good way to think about it.
Celebrate those small victories along the way, and don't be afraid to adjust your expectations if you need to.
Listen to your body, right?
Always listen to your body.
This has been an incredible deep dive.
I've enjoyed it.
We've learned so much.
We have.
From the anatomy of the knee to all these different treatment options.
It's amazing how much is out there.
It is. Conservative treatments, surgical options. We even talked about getting back to high-impact activities after surgery.
It's pretty remarkable what's possible these days.
So what's the one thing you want our listeners to remember?
This chapter really drives home the point that age doesn't have to define our limits.
I love that.
There are ways to keep our knees healthy and keep doing the things we love.
Yeah.
Even as we get older.
And even if surgery is part of the journey.
Exactly.
That's a powerful message.
It is.
So where can our listeners go to learn more?
Oh, there's some great resources out there.
Okay, tell us about them.
The Arthritis Foundation has a ton of great information on their website.
Oh, yeah, they're a good resource.
Yeah, all about managing osteoarthritis, exercise tips, advice on protecting your joints.
I bet they even have tips for finding a good physical therapist.
You bet they do.
Perfect.
And, don't underestimate the power of connecting with other people.
Oh, right. Like support groups.
Yeah, online forums, that kind of thing.
Yeah.
It can be so helpful to talk to others who are going through the same thing.
It's so true.
Share information, get advice, and just realize that you're not alone.
Yeah, that sense of community can make a big difference.
Absolutely.
Especially when you're dealing with a health challenge.
It can feel isolating.
It can.
So yeah, definitely seek out those support networks.
Good advice.
And remember, knowledge is power. The more you know about your knee health,
right,
the better equipped you'll be to make good decisions.
Yeah, to advocate for yourself.
Exactly.
And stay active.
And keep doing the things you enjoy.
I like that. Keep exploring, keep learning, and keep moving.
I love it.
This whole deep dive has really given me a fresh perspective.
That's great to hear.
On aging gracefully and staying active.
That's what it's all about.
It is.
It's been a pleasure diving into this with you.
Likewise.
Always fun to talk knees.
Always. Well, we've covered a lot of ground today.
We have.
From the basics of knee anatomy to all sorts of treatment options.
Conservative and surgical.
Yeah, it's amazing what's possible.
It is.
So as we wrap up, what's the one key message you want to leave our listeners with?
I really hope people remember that while age brings changes, it doesn't have to define our limits.
Yeah, you don't have to let age dictate what you can and can't do.
Exactly. There are things we can do to take care of our knees and keep enjoying life to the fullest.
Even if surgery becomes necessary.
Absolutely. Even then, there's so much you can still do.
Beautifully said.
Thank you.
Well, on that note, we'll wrap up this deep dive into knee health.
Sounds good.
We hope you found it informative and empowering.
I hope so.
Remember, knowledge is power, so keep learning, keep exploring, and keep moving.
Couldn't have said it better myself.
Until next time.